like in COVID times where people were so stressed. So if you do these practices every day, it will make a difference, right?
And we saw this during and I want to share with you my experience of, yes, COVID time. There was a lot of fear, and then people came forward and really these practices, and after that the doctors, whatever programs we did during COVID time were mostly online. Actually, pretty much all of them were online. So what people shared, that mentally, emotionally, even spiritually, it made such a big difference. It gave such a meaning to what they had been doing despite the fear, which was very real, really. And I have myself experienced that. Going in, walking into that room where the patient is connected to a ventilator and the room is filled with COVID virus in the air, right? And you're breathing in that. So the fear was very real, and yet lot of the course graduates have shared that it really rejuvenated their, some of the words, if I could recall, rekindled their joy of practicing medicine. The meaning why I went to medical school was rejuvenated, and people really had such a strong impact. So the story that I was going to share is in year 94, 95, 96. Those were the 3 years I was doing internal medicine residency. In United States, before you become a licensed physician, be able to practice, you have to go through residency, the training program. So for internal medicine, it was 3 years. And in 94, I entered into, and then I was at that time practicing into South Bronx. You're a little bit familiar with New York anatomy. So South Bronx is a very very highly densely populated by Latino and Afro American. Poverty is there, less education, health disparities, not enough resources. In that kind of setting, in 94, 95, 96, and probably you were very young then, but it was the peak of AIDS at that time. And that is when I was getting training. So just imagine the the mentality of a very young physician who's looking for a bright future. And here you're dealing, every medical floor was filled with patients with florid AIDS and also multi-drug resistant tuberculosis. So that is the time the nurses, the doctors would be, again, just like what we experienced during pandemic. We had that kind of experience at that time, and we would just go in, because I did this, I think it's raising the hand. Your Zoom, yeah. So, and that was the year that I was introduced into doing this program. Rashri, the Philip, they taught me this program. And it was such a big difference in my daily routine, my energy level, my sensitivity, my enthusiasm. A lot of was changing, and like not suddenly overnight, but every day I would practice and I would notice these changes. So that is the time we offered this program to the group of lot of AIDS patients who were also going through de-addiction, like half house. They would live there for 3-4 weeks, and then they would be narcotic addiction, alcohol addiction, all kinds of, cocaine, heroin. So we did this program in that addiction program, and we know how people really felt um, after, and it was a long program. We offered them like 5 kriyas, 10-day program. Every alternate day we would do a long kriya, and they would go through that. So that was my early days experience of what Sudarshan Kriya can do. Not just personally, also what I saw it can do to the patients. So then when I became teacher, I started teaching these programs. Yeah.
Very powerful experience.